Gastroesophageal reflux disease, or GERD, is a chronic digestive disease that occurs when stomach acid frequently flows back into the esophagus. This backwash, called acid reflux, can irritate the lining of your esophagus. While occasional acid reflux is common, experiencing it frequently, more than twice a week, may indicate GERD. Join us as we explore the ins and outs of this common condition, from its causes and symptoms to diagnosis, treatment, and prevention. GERD's primary cause is the frequent backflow of stomach acid or bile into the esophagus. This happens when the lower esophageal sphincter, or LUS, which acts as a valve between the esophagus and stomach, weakens or relaxes inappropriately. Several factors can contribute to this, including hiatal hernia, obpregnancy, delayed stomach emptying, connective tissue disorders like scleroderma, and certain lifestyle choices such as smoking, eating large meals, or lying down immediately after eating. Certain medications, like NSAIDs, aspirin, and some blood pressure medications can also exacerbate GERD. Normally, after food passes through the esophagus and into the stomach, the LES closes to prevent stomach contents from flowing back up. In GERD, the weakened or relaxed S allows stomach acid to reflux into the esophagus. The lining of the esophagus is not equipped to handle the acidity of stomach acid, leading to irritation and inflammation. Over time, this chronic inflammation can lead to more serious complications such as esophagitis, esophageal strictures, or even Barrett's esophagus, a precancerous condition. GERD is a very common condition, affecting an estimated 20% of adults in Western countries. While it can affect people of all ages, it is more prevalent in older adults, pregnant women, individuals with obesity, and those with certain medical conditions like asthma or diabetes. Lifestyle factors such as diet and smoking also play a significant role in GERD prevalence. The most common symptom of GERD is heartburn, a burning sensation in the chest that often occurs after eating and may be worse at night. Other symptoms include regurgitation of food or sour liquid, difficulty swallowing, dysphagia, chronic cough, laryngitis, inflammation of the voice box, a feeling of a lump in the throat, new or worsening asthma, and disrupted sleep. In some cases, GERD can even cause chest pain that mimics a heart attack, making it crucial to seek medical attention for proper diagnosis. Diagnosing GERD typically involves a combination of symptom evaluation and diagnostic testing. A healthcare provider will start by reviewing your medical history and symptoms. If symptoms are mild and infrequent, lifestyle modifications and over-the-counter medications may be recommended initially. For more severe or persistent symptoms, diagnostic tests may be necessary. These include upper endoscopy, where a thin, flexible tube with a camera is inserted into the esophagus to visualize the lining. Esophageal pH monitoring, which measures the amount of acid in the esophagus over a 24-hour period, and esophageal manometry, which assesses the function of the LUS and the muscles in the esophagus. While GERD isn't strictly classified into different types, the severity of the disease and the presence of complications often dictate the treatment approach. GERD can range from mild, infrequent heartburn to severe, erosive esophagitis. The presence of complications such as Barrett's esophagus also influences the treatment strategy. Treatment for GERD aims to reduce acid production, heal the esophagus, and prevent complications. Lifestyle modifications are often the first line of defense, including avoiding trigger foods, eating smaller meals, not lying down after eating, losing weight if overweight or obese, and quitting smoking. Over-the-counter medications like antacids can provide temporary relief. For more persistent symptoms, prescription medications such as H2 receptor blockers and proton pump inhibitors, or PPIs, are often prescribed to reduce acid production. In some cases, surgery, such as fundoplication, may be necessary to strengthen the LES. Preventing GERD involves adopting healthy lifestyle habits. These include maintaining a healthy weight, avoiding trigger foods like fatty or spicy foods, chocolate, caffeine and alcohol, eating smaller meals, not lying down for at least 3 hours after eating, raising the head of your bed by 6 to 8 inches, and quitting smoking. By making these changes, you can significantly reduce your risk of developing GERD or manage existing symptoms. With proper treatment and management, the prognosis for GERD is generally good. Most individuals can effectively control their symptoms and prevent complications with lifestyle modifications and medication. However, untreated GERD can lead to serious complications such as esophagitis, esophageal strictures, Barrett's esophagus, and an increased risk of esophageal cancer. Recent research is focused on developing more effective and targeted therapies for GERD, including new medications and minimally invasive surgical techniques to improve the function of the LS and reduce acid reflux.